What's up, y'all? This is Carolina Doc PT, and I am a licensed and practicing doctor of physical therapy. And in today's video, we're going to be talking about should you have a total knee replacement? That's a topic that, or a question that I've been asked, not just from patients recently, but actually just acquaintances and people we've seen at church. It's also there's a couple of comments that have been left on a previous video that I did regarding knee replacements and should people or should patients even be getting them and having them done. And so I thought this would be a good video just to address several of those types of topics. So um, should you have a knee replacement? That's going to depend on a lot of factors, okay? And these are things that you're certainly going to want to talk with your orthopedic surgeon. You're going to want to talk with your family. You're going to want to talk to your insurance company to find out how much you're going to have to pay for this. But the I think the number one thing that you're going to want to consider is what is your life like currently versus what it could be. Okay. I find that patients that have had a lot of pain, and a lot of arthritis in their knee, and people that have worn out therapy. Like, yes, physical therapy can help with that. You can go to uh, seek physical therapy care with a lot of manual therapy being done by a clinician that knows what they're doing. I've have had those types of patients where they were told by their surgeon that they were going to have to do a knee replacement, and I was able to work with them and do myofascial work all around their knee, and we got it to where that knee was basically pain free. So what your function is like currently versus what you would want it to be is probably one of the bigger things that you're wanting to think about when you're trying to make that decision of should I get a knee replacement. You're also going to want to think about it's well, what is that pain like? Some patients that are having so much pain that they just it's sometimes that arthritis pain can be like unrelenting a lot of times, and so I know I've certainly had patients who have gone into having a knee replacement thinking that hey, yes, they know that the surgery itself is going to be painful, but um, it's much better than, or at least it would be different than the pain that they've already been experiencing. So that is going to be a factor. What level of pain are you in? What is your health history like? So someone that comes in with a lot of complications in your health history, and that's that does make this, I would say, a riskier surgery. So in that case, you're going to want to talk to your orthopedic surgeon. You're also going to want to talk to your primary care physician. I've certainly have had and currently have patients who could really use having a knee replacement and actually would like to seek a knee replacement, but they're unable to because their health history is just too, and it's too risky. Their current health situation is just too threatening, and so no surgeon will touch them because they're scared, that they would not make it successfully through the surgery. So that is going to be a factor. Is what is your health history like? Um, Also, I would say not just that is um, what's your activity level like? So if you come into this type of a surgery and you are somebody who has been working out, all of your life, you were an athlete, you're somebody who is used to dealing with and having pain, this may be a very different experience for you than for those patients who have never done anything like that. Like maybe if you're somebody who's just been sitting in a desk job all your life and you really have never worked out very much. Some people have just, been moms and they've been doing all the normal stuff that moms do, but they just don't have a lot of time to work out. They'd really have never gotten into that type of lifestyle. And so going into this type of a of pain and this type of recovery is something that would be very new to their body. Um, so that would be a factor to consider. The risk of these surgeries. Normally, and I've said in other videos that knee replacements surgeries are highly successful, and they are. Uh, it's a can't talk. Sorry. Uh, it's on the order of 90% or over 90%, let's say. So that's extremely high success rate. Is it 100%? No, it is not. It is. There are definitely things that can uh, lead to issues with this recovering from this procedure. And I think the like risk of infections and the risk of just complications developing post surgery, I think it's like 2 out of 100 patients are going to experience something like that. So it's not 100% certainty that you will go through this without difficulties and without challenges. But that said, it's a very highly successful surgery. So that is, you have to balance out that risk and say, well, is the pain that I'm going to be in when I'm doing the surgery going to be worth the risk or managing the risk of the surgery itself? So another thing to consider is going to be age, and age is not. Sometimes people think about age as being kind of similar to a person's health history, and well, because a person's old, or what they can perceive to be old, quote unquote, that they won't be able to survive a surgery or whatnot. That's not exactly what I mean. That could certainly be a little bit of a factor, but that's really more of a personal history situation. What you're really thinking about when you consider age is going to be, what is the life of the new knee going to be? So ideally, a knee replacement is going to be for a patient that would be, say, in their 70s to 80s, because the chance that they are going to need to replace that again and do a redo of the original surgery is much lower. If you, say, are in your early 50s and you get your knee replaced, well, that joint is only going to last like 18 to 20 years. And so, looking at how long most people are going to live, there's a very good chance that you're going to need to have that knee redone, especially also because somebody that's in their 50s is um, a lot more active, and so they're going to get a lot more wear and tear on that joint than, say, somebody who is 75 years old. That person probably not moving around quite as much. Hopefully, they are moving around some, but it's movement and how long that knee is going to last that you're really thinking about with age. So I, those are really the main areas that I'm thinking of. You're thinking about what your current function is, what your pain level currently is. You're thinking about what your personal health history is like, both good and bad. You're thinking about just the risks involved, and because complications can um, can happen with these. And then you're thinking about, what is your age? Those are really, I would say, the five or so main areas that you are wanting to consider you when you're trying to decide, should you have a knee replacement. Um, these You're going to want to have, discussions with your primary care physician, especially if you have complications in your health history. And you're going to want to have a lot of discussions with your surgeon. You can go and have second opinions with other surgeons. You can research in your area and find out, who are those skilled surgeons, and you can get, word of mouth, talk to friends that have had this surgery done. You can ask for references from the surgeon that you're considering, and get, those, get, patients. A lot of times they'll ask other patients to say, hey, do you mind if we give your name out in case somebody, was to ask for a reference or something regarding how this surgery went from them. So you could do something like that. Um, in general, what would I say as a physical therapist for someone that is seeking a knee replacement? I would say in general, if you do not have a complicated health history and you're in that 70 to 80 range for sure, age range, I would give the surgery a go. To, especially if you're having a significant amount of pain, um, it is a very highly successful surgery. That said, it is not 100% successful. It's there will be a small percentage of patients who have difficulties with it, um, and so but that's going to be the same. I mean, this is healthcare. Healthcare is a practice, right? So nothing is certain. There's not a precise outcome that you're going to be able to say for anything. But is the risk potentially worth it? Yeah, I would say so, especially if you have done everything else to exhaust ways to reduce your pain. You've done physical therapy. You've had a good manual and a skilled manual therapist work with you for a while, and you've taken the injections that the injections to the knee that they're able to do now to add in the lubricant there, and even the steroid injections. You've worn all those out. Everything is you've done everything. Then if you are able to have the surgery, what I encounter and what I experience for the vast majority of patients, not 100%, but for the vast majority of patients, they are very happy that they did the surgery. Again, not 100%, but the vast majority of patients are going to say 6 months down the road, a year down the road, wow, this was the best decision I ever made. I should have done this sooner. So I, for the most of those folks, as I say, I would give it a whirl. So I hope that this video has been helpful to you. I've tried to it was a little bit of rambling, but I'm trying to discuss through the ins and outs of what you should consider when you're trying to decide should you have a knee replacement done. So I hope it's helpful for you. If it was, give this video a thumbs up, subscribe to the channel, and we will catch you later. Thank you.